we'll kick off. I'm Professor Tracy O'Brien, the New South Wales Chief Cancer Officer and the CEO of the Cancer Institute of New South Wales. I'm pleased to welcome everybody tonight to the continuing Cancer Conversation series ongoing in 2024. Tonight's event has been heavily subscribed. To date, over 600 people have registered for the session right across all walks of New South Wales in healthcare, across the tertiary, primary and community care. We've got some education members joining us as well. And there are a number of interstate and international registrants as well. So welcome to everyone. I would like to begin by acknowledging the traditional custodians of the land from which we're all meeting and gathering tonight and joining virtually. I'm joining from the unceded lands of the Cammeraygal people, and I pay my respects sincerely to their ancestors and elders, and I extend that respect to all First Nations people joining tonight. I'd also like to acknowledge the strength and the resilience of Aboriginal people, the world's longest surviving culture, and recognise the role of First Nations people as Australia's first healers. For those of you that are joining for the first time, Cancer Conversations is an ongoing webinar series. It's led by the New South Wales Cancer Institute. Our intent is to really bring together experts, health leaders, to catalyse a conversation, to share knowledge and to foster a system-wide collaboration by discussing emerging issues, hot topics and innovations in cancer control. We do take requests from our many partners and collaborators across the cancer control system, and vaping was one of the most requested audience topics. So in the session tonight, we hope to cover some of the evolving evidence related to harms of vaping, some guidance on cessation, and to get a better understanding of the evolving policy and regulatory landscape, among other things. Now, before I introduce our esteemed panelists, just some quick housekeeping. There are hundreds of people online, and as such, cameras have been disabled or will crash the NBN. You'll only see the speakers tonight. The chat function has also been disabled, but the Q&A function is working, and we do encourage you to put through your questions. There are online moderators, and they'll shoot those and collate those questions through to me, and I'll do my best to throw those questions to our speakers. So let's crack on with the conversation. We've got four fabulous experts joining us tonight. Dr. Kerry Chant, the New South Wales Chief Health Officer and Deputy Secretary of Population and Public Health. Kerry really needs little introduction. She helped steer the state through the COVID pandemic with a calm intelligence that was unparalleled and highly respected. Kerry manages many public health portfolios within the ministry and plays really the leadership role in the New South Wales health response to vaping. We've also got joining tonight Professor Matthew Peters, the Head of Respiratory Medicine at Concord Hospital and Professor of Respiratory Medicine at Macquarie University. Now, Matthew's got 3 decades of experience in tobacco control. He is an advisor to the ministry and to the Cancer Institute on vaping. He served on the National Health and Medical Research Council advisory for their electronic cigarette statement as well. And Matthew works proactively with the education sector, with teachers, with students, as these communities address vaping as a health issue for young people. Pleased also to welcome Dr. Bronwyn Milne, who's a general paediatrician and addiction medicine specialist and has been working directly in the front lines with adolescents and young people for almost 2 decades. Bronwyn was instrumental in establishing the Cicada Drug and Alcohol Service and is the head of department of adolescent medicine at the Sydney Children's Hospital Network. Bronwyn is passionate about helping young people improve their general health and well-being and fulfilling their potential in every sphere of their life. And finally, Kate Reeks has graciously stepped into the hot seat at the last minute to join us this evening as Dr. Sandra Rickards is unwell. Kate, whose preferred pronouns are they, them, manages cancer prevention at the Cancer Institute of New South Wales and has over a decade of experience working in public health across the domains of mental health, drug and alcohol, sexual and youth health, as well as policy and program expertise in harm reduction, tobacco, and skin and cancer prevention. So we've got a terrific lineup of experts to help navigate this topic. So I do thank all of our experts for taking the time and joining us tonight. Now, Kerry, if I could start with you, as the Chief Medical Officer, vaping really has emerged as quite a significant public health issue, with the rates of those who currently vape, either daily or occasionally, continuing to rise, arguably quite sharply, particularly in the 16 to 24-year-old age group. Why do you think, Kerry, vaping is such a health concern? And can you talk us through the proven health harms of vaping?
Thanks very much, Tracy. And before I commence, can I just acknowledge the traditional custodians of the lands on which I'm coming from, and pay my respects to elders past, present and emerging, and acknowledge any elders with us today. So in terms of e-cigarettes, I think one of the salient comments you've made is that there's been such a rapid increase. So this has been a slow burn issue that we've been concerned about the impact of e-cigarettes for a while. But what we've seen in recent years is a really rapid increase in the trajectory of use, particularly and most concerningly amongst young people. Firstly, e-cigarettes expose the users to a large range of chemicals and toxins, and many of those we know have the potential to cause harm. Some of those chemicals are associated with cancer, heart disease, and lung damage. We also know that there are potent ways of administering nicotine, and we know nicotine is a highly addictive substance. And clearly, when we've been talking to our young people, it's the nicotine addiction where the necessity to vape is taking control of their lives that comes across for me as one of the salient feedback from young people about how this turns from a initially social experience into something that is incredibly unpleasant and, as I said, takes control of their life. We know that the brain develops over a protracted period of time, and so for young people, regular nicotine consumption can result in changes to brain development, impaired attention, learning and memory, mood changes, and the potential to worsen stress and increase depression and anxiety. And ironically, some young people might be using this to relieve stress, but a vicious cycle of addiction and withdrawal get established. And Bronwyn can speak more eloquently than I about that impact on particularly young people. So probably that's in summary, and I would also just like to know that I know Matthew will be probably talking a bit later about the fact that we have seen some emergent studies that show that vaping basically sets up inflammatory processes, and that in itself is likely to be precursors for fibrotic changes or for cancer. We are in the early phases of collecting information about vapes, but clearly from a public health perspective, because of those other reasons alone, we really want to minimise the use of e-cigarettes and have it confined more to a therapeutic use case.
Yeah. Okay, great. Thanks, Kerry. Matthew, it'd be great to bring you into the conversation and get you to elaborate a little bit further as an expert in lung disease. Lung disease is one of the more significant serious impacts of vaping, as Kerry alluded to. As a respiratory specialist, what are you seeing in your practice in terms of lung injury or lung damage as related to vaping?
Well, we know a lot, and I first acknowledge that I'm on the traditional and continuing lands of the Wallamadigal people when I'm talking to you all tonight, and welcome. Well, what we see is frequent respiratory symptoms: cough, wheeze, breathlessness, coughing up, sputum. occurring at young ages and really at ages where we would not ordinarily expect to see that with combustible tobacco, with traditional smoking. And as we've seen in the Cancer Institute campaign, resolution of some of those symptoms, at least after vaping cessation. But one of the intriguing things here, the Cancer Institute's a research-focused, supports research, is that distinct from, say, the smoking and lung cancer story, it was 20 to 30 years before the first brave souls came out and ventured a link, and that wasn't believed to be a link, and it took further basic science research to eventually explain how smoking caused lung cancer as we best understand it. And on this occasion with vaping, we've got a wealth of basic science information already. As Dr. Chance said, it is inflammatory. It's inflammatory in the arteries, it's inflammatory in the lung, it's inflammatory in the mouth and causes dental decay and all sorts of things that children and adolescents don't really want to have. And these are immediate effects. We're seeing them really quickly. And it's rather disturbing. The lungs themselves are the size of a tennis court. You only want to paint them with air. You certainly don't want to paint them with the range of chemicals that you get in a vape. I think probably I'll pass on now.
Can I just push you a little bit further, and perhaps Dorothy Dixer coming from me as the Chief Cancer Officer, but the laboratory data, what do you think about that in terms of the longer term risks of cancers?
Well, I mean, we know there are certain early molecular changes that occur in the sequence of processes that end up with a clinical cancer. And those certainly in the oral cavity, which is clearly exposed and is probably a signal for what's going on in the lower respiratory tract and maybe elsewhere, that the changes are just as bad with smoking and vaping equally. And that's not a good competition to have, frankly. You don't want to come equally in that race. So based on what we currently know, the effect appears to be similar, and hopefully this is a phase we'll go over and we won't ever see the long-term effects. But we don't want this generation of young people to experience the same problems that 2 or 3 generations before them experienced with smoking and lung cancer and all other cancers, of course, which are linked with smoking.
Yeah. As you say, there are 15 other different types of cancer related to smoking, not just lung cancer. Bronwyn, if I could bring you into the conversation, Kerry mentioned nicotine and the effects on young people in particular. Now, nicotine itself doesn't cause cancer. That's a bit of a common misconception. People think that's the bit that's nasty in the cigarettes, but it is a powerful drug. I'm really keen to understand a bit more about the impact of nicotine consumption, dependency and addiction. We know that 97% of the confiscated vapes from schools in Greater Sydney contain nicotine. Can you share your experience as an adolescent expert and an addiction expert? What are you seeing in terms of the physical, the mental impacts because of nicotine?
Yeah, thanks, Tracy, and hi, everybody. So I'm just coming to you tonight on the lens of the Darug people of the Eora Nation. I'd like to also pay my respects to the elders past and present and those emerging, young people who are going to be the elders of our future. Look, we have certainly seen an increased presentation of young people who are vaping, as we can see in all of the data, but they're coming in through our hospitals and through our health systems. And I work specifically in a youth drug and alcohol service, and the population that we see certainly have much higher prevalence than the general population of vaping, as well as other substance use as well. So we certainly are seeing increased presentations. Young people are starting their vaping early, even less than their teens, but it's not uncommon, 12, 13, and then their vaping history is already 2 or 3 years, often when I see them in my clinic. Young people, the reasons for starting vaping, they tell us, is really because they're curious. Maybe their friends might have offered them a vape. They're trying the different flavors. Of course, a lot of the disposable vapes are really targeting young people. And attractive to them, even the size of what they look like, little USB sticks or, like highlighters. So they're very easy to hide in their school, pencil case or their bags and what have you, carrying them on them very, very easily. And they can vape at any time, where there's not restrictions. So young people, tell us that when they first start, they definitely get that addiction very quickly. They may want to try, just once or twice, but then that addiction, rapidly comes on. So we're certainly seeing increased presentations. And Tracy, you asked about that nicotine and how that impacts on young people. And Kerry also mentioned, we know that the vapes, very high percentage of nicotine in those vapes, although they're not often labelled, so the young people don't know, when they're purchasing or buying or getting it from their friend, what's actually in those vapes. But the presentations is around that, the rapid response of the nicotine in their bodies, but then that addiction cycle happens very quickly. We're seeing young people who are dependent on nicotine and suffer withdrawal symptoms, and some of those withdrawal symptoms, might be, after not using a vape for maybe 24 hours, irritability or increased anxiety, impact on their mood. It also can impact appetite and their concentration, impacting on their sleep. And one of the telltale signs for dependence is that time to first vape. And when you ask a young person who is vaping, they often hide it under their pillow or it's right next to their bed. So the minute that they wake up in the morning, it's the very first thing, even sometimes before, reaching for their phone, they'll reach for the vape. And, some young people even waking up in the night to vape. So I think some of those signs, really identify that nicotine addiction for young people. And in my experience, I would say young people are actually keen to quit. They often, acknowledge that there's this new pattern that they are wanting to try and kick this habit, but it's actually really hard for them because of those withdrawals. And I was talking to a young person only last week, and he was so proud to tell me that he'd quit vaping. I go, good on you, mate. How did you do that? He goes, well, I just started cigarettes because they really help. So I think we are certainly seeing increased presentations of young people with dual use, vaping and cigarette use. And also we know from the data, but also clinically, young people are increasing, the uptake of cigarettes.
Yeah, okay. We'll come back to a couple of those things around the gateway effect and particularly the cessation. But Kerry, if I could just go back to you. The Australian government is introducing a range of vaping reforms. Can you lay out for the audience what those reforms mean and what the changes we're likely to see and what these changes mean for us in New South Wales as well?
So I suppose at the moment it's probably important for the audience to understand that technically you should not be able to get a vape containing nicotine in retail premises. But the reality is that the vapes that are sold in retail premises contain nicotine, even though it doesn't appear on the label, the vast majority. And we know that from our studies where we've tested them extensively, and we've also seized large volumes of the product. So in terms of what has changed, the reforms are being implemented over 2024, and the first step was importation bans on the disposable single-use vapes, and all non-therapeutic vapes are in effect, with the Commonwealth agency seizing these products at the border. The Australian government introduced legislation into the Australian Parliament on the 21st of March 2024, and that bill seeks to impose a domestic ban on the manufacture, supply, advertising and commercial possession of all non-therapeutic vapes. So this legislation will complement, reinforce the importation bans that are already in place. During 2024, the Therapeutic Goods Administration also intends to strengthen product standards for therapeutic vapes, such as pharmaceutical packaging, limiting the flavours and reducing permissible nicotine concentrations. And New South Wales Health is supportive of the changes, and we will be looking at our legislation. Although we can just adopt holus bolus, the Commonwealth, we will probably refine and make some minor modifications to our own legislation to simplify both our public health and tobacco legislation.
Okay, great, thank you. So let's turn just now to think about helping changing behaviour and cessation. And Kate, I wanted to bring you into the conversation at this point. The Institute is responsible for the vaping behaviour change campaigns and provision of cessation tools. And a lot of field research goes into the development of these things, and we know it's particularly important to hear directly from young people in particular, but all people that vape from all walks of their life. Can you share with us a bit how this intelligence is gathered, and what are some of the beliefs, the behaviours that you've needed to navigate, address, and use within the campaign and in the associated products?
Yeah, thanks, Tracy. Hi, everyone. I'm on Gadigal and Wongal land, and so pay respect to the elders of these lands that I'm calling in from. So we're working with young people. They are such an informed and a diverse group of people. And look, I'm not sure if it's been said yet, but most young people don't vape. But it might feel like everyone is to young people. There's a real kind of sense of normalization among young people, but it's good to be reinforcing that most young people don't continually vape. So much of this cohort, they live their lives on social media. Bronwyn mentioned, picking up your phone is the first or maybe the second thing if you've got a vape in your hand or under your pillow when you wake up in the morning. In that social media world, there's so much safety to be able to express who you are or have control about how you present yourself to the world as a young person. It's a platform where young people pick up on social trends and influences. It's where the capital I influencers and celebrities, but also suppliers try to relate to young people. But it's also where young people will learn about what's hot or not. And so it's a really great place for us to be with campaigns to really reinforce these positive health behaviours. They're also really savvy about knowing when they're being marketed to, and will tune out and scroll past ads pretty quickly. And so for us, finding ways to be part of the world and cut through has been really essential for the messages to be heard and to resonate around not vaping. So the approach that we have taken really is to put young people at the centre of what we do. Young people have been the lead in our campaign development and the stars in the delivery as well. We're working with young people on the optimisation and the development of our services, as well as the campaigns that we're delivering. Many of you will have seen our new campaign, that every vape is a hit to your health. It launched at the beginning of the year. If you're a young person, you will have seen it on your social media for sure. If you're like me, maybe a little older than our 24 up to 24 age group, you've probably seen it on a bus or a train stop or at the movies, that kind of thing. But in terms of our campaign development, the full development includes several stages of qualitative, quantitative research, just to really understand our young people audience, so 14 to 24, and really tailor that campaign to them. We use evidence, and then we research with young people to understand responses to like test message areas or themes like the health effects or the risk of addiction around vaping, those kind of big overarching ideas. Then we take the findings from what they've said to us there, and we develop creative concepts like the every vape is a hit to your health. And then we go through more testing. We talk to more young people. We understand whether there's risks with the campaign materials or the messages with different cohorts of young people, particularly with Aboriginal young people that we do our research with as well. That might be through focus groups or online surveys or one-to-one interviews. And in this, in the development of this campaign, we talked to hundreds of young people to really make sure that we were able to hit the mark, get the messages right, the concept right, the tone right, the imagery right, so that the campaign is engaging and, most importantly, does influence behaviour change. And so we're everywhere. We're at those bus stops, train stations, in the social media channels, especially where the young people are, digital advertising and cinema advertising, as well as the more traditional methods that you might have seen. We also make sure that we are working with people with authority. So it might be health professionals, or it could be the influencers. So we've been working with Dr. Carl. Most people will know Dr. Carl, but then we also have sports people like Sam Stubbs or Tilly Kearns, or NRL players, or Alira Potter, who's a wellness practitioner. And then there's more influencers coming up. So it's making sure that we're able to engage with a range of young people that really reflect the diversity of the young people that we're trying to influence the behaviour in a really positive way.
Terrific.
I might pause there.
Yeah, no, thank you. That's really, really good. Matthew, if I could go back to you, and I'll put this question to you, but keen to hear from other panel members as well. E-cigarettes were initially positioned as a tool to quit smoking, and there are many that remain an advocate for their role in harm minimisation. Can you share your thoughts on this, and particularly in relation to different user groups? You know, for example, adults that have smoked for a long time and are looking to quit, versus young people who vape now and are looking for cessation mechanisms.
Okay, so yeah, Tracy, I think probably we separate those two things out. Harm reduction and smoking cessation are two very different things. Harm reduction has been a serial failure when it comes to smoking. You know, lower tar cigarettes, adding filter, mild cigarettes, light cigarettes, smoking fewer cigarettes a day were all promoted as harm reduction, and none of them reduced the risks of major respiratory, vascular or cancer development. So the evidence that actually e-cigarettes are safer for a long-term user than continuing to smoke is incredibly soft. But there are percentage differences quoted out there completely based completely on no evidence, but they have become prevalent. I think the 95% number, for example, was just cooked up by a group of people around a table in a country house one weekend. So you're right in the introduction that there are some things in e-cigarettes. So there are some things in smoking that don't exist in e-cigarettes, but there are many chemicals in e-cigarettes that are not in combustible tobacco smoke. So let's address the harm reduction, and it's a speculative endeavour. And I'm not now. I basically hear people say it, and my view is that anyone who tells you exactly what the harm difference is between smoking and vaping shouldn't be listened to, because nobody knows. I don't know. Now, when it comes to smoking cessation, it's a different thing. Somebody who has tried approved TGA, registered medications, whether it's nicotine replacement therapy or an oral treatment, who has tried very hard to quit, and genuinely with appropriate support, and has been unable to quit, and is keen to try vaping as an alternative cessation tool, there is a genuine place, and its effect is probably at or around the effect of nicotine replacement therapy, maybe a bit more, but not dramatically more. But it's a tool to be used under careful medical guidance, with the intent of a brief period of use, followed by complete cessation of both smoking and vaping, and the complete avoidance of combined or dual use, which is vaping and smoking at the same time. That might happen for a short period of time. Okay, that's okay, but not long term. And again, I go back to the basic sciences, and perhaps vascular disease, where this is best studied, is that they both damage the arteries, but they work through different chemical and molecular pathways. There's actually a genuine theoretical concern that smoking and vaping at the same time may be worse than either. Okay, so that's for vascular, based on basic sciences. So yeah, there is an important place under medical supervision. I've been an advocate for the prescription model, which is the preferred model put forward by the federal government and supported by the states, with well-informed GPs providing good advice to people who choose this form of assistance, supported by the Quit Line and other sort of medical educational bodies. And I'm trying to do some of that education. So it's really important. No one wants to ban e-cigarettes completely. We're not at that point at all, but we want them well used to achieve a public health gain, not a public health harm.
Yeah, okay. Bronwyn, did you want to add to that as an addiction specialist from your point of view as well?
Yeah, I think when we're just thinking about young people, one comment is that young people actually don't necessarily think about the medium to long-term effects.
Yep.
They think about the short-term effects. So medium term might be like a couple of weeks to them, you know, lucky to push a month. So if you're thinking about the very long term, what's going to happen to them in 10 or 20 or 30 years, that's not going to cut it really, I don't think, as a motivator for them to have any change. So I think that's just one reflection, you know, on the comments of thinking about long term, although we do talk about it with young people, but it's probably some of those other things that will be more of a motivator to you know, for change, you know, around maybe stress management or what, you know, that cycle of addiction and what's happening with their mood and sleep and appetite, etc. Yeah, so that's maybe just one little comment on the thinking about the long-term effects. But of course, that's something that we all worry about, you know, not knowing, you know, really the longer-term effects of vaping, and that dual use, particularly with young people who then pick up cigarette smoking after vaping.
Mm-hmm. Yeah. Okay. Kate, that's certainly the experience in the research that was done in terms of the campaigns, that young people aren't looking to the longer terms, and most of the messaging is very much short term messaging. Is that correct?
Yeah, that's right. With the campaign, the Every Vape is a Hit to Your Health, we really juxtapose what might be perceived as benefits of vaping. So it might be, you know, the cool colors or the short-term benefits, but also with the harms of vaping as well, to really get people to think about whether it's worth it. I mean, some of the themes that have come up with the research that we've done with young people, particularly with campaigns, but also in the optimization of our services, you know, young people talk about the benefits around social connection. Something like I think it was Bronwyn said before, some of the benefits of nicotine, you know, as a stimulant or appetite suppressant, and then also the perceived ability to deal with stress or anxiety. But as we know, I think Kerry might have mentioned, it's probably got more to do with managing those withdrawal effects. They want to know more about what's in vapes and the harms of vaping. You know, they're kind of the impact on their breathing and their fitness. They might see it as a bit of fun or a bit less smelly than tobacco with their risk taking, but they're really often surprised. They report that they're surprised about how addictive vaping it is and how uncomfortable they feel about addiction. They kind of often start vaping because they're curious or they've been offered a vape, and I mentioned social norms and earlier, and so there's the social norm aspect to it and social connection, fitting in, and I guess some of that's kind of peer pressure, but maybe not the peer pressure that we might have all experienced as young people, you know, or the way that we might envision peer pressure. But that peer pressure works the other way as well. So people in our research have said that they want to hear stories from other young people. Those stories resonate really strongly. They want to know that people have stopped vaping. They want to know that others have quit, that it is absolutely achievable. And it's fabulous that we've also attracted so many young people to work with us on our campaigns, to be able to share their stories about the damage that vaping has done to them, but also that they have been able to quit. And it's just such a positive social movement and such positive peer group pressure, I suppose, in that towards health behaviours. Yeah,
it's good to hear that positive message for sure. Bronwyn, drug and alcohol addiction and serious mental health issues are, you know, scary things for every individual, for parents, for families, but particularly as you navigate through adolescence being a particularly vulnerable time. And I've heard many a parent say, and I've got teenagers, so I'm sympathetic to this view as well, that, you know, vaping's not that bad compared with all of the other things that are facing young people at the moment. What's your view on that in terms of being an adolescent medicine specialist and an addiction specialist?
Oh, look, whenever we see young people, we really try to, you know, engage them and look at the big picture of what's going on in their life, you know. So I think we take vaping, you know, if there is a, you know, history of vaping or nicotine dependence, you know, and that's isolated, then the young person might be interested and willing to do something about that. You know, then we will work with that young person around their goals and around their motivation, around their stage of change, where they're up to. But if vaping's one thing and there's lots of other complexities, you know, going on, then we, look at, what's a priority for that young person. Of course, any intervention to help reduce or quit their vaping, is part of that health plan, but we've got to work with the young person around what's important to them. If there's other very complex mental health issues or other substance use or other medical, issues, we work collaboratively with the young person in a holistic way, looking at everything, looking at their psychosocial, mental health, developmental issues, family, all of those together.
Yeah, thank you. Another question coming through from the audience, and I'll throw this open to the panel. It might be a Matthew or Kerry question. What's the correlation in the amount of vaping to smoking is the question. In medicine, we think of pack years to get an appreciation of someone who's a smoker. Is there an equivalent thing for vaping, such as a 20 pack year history or a 20 cigarettes per day for 20 years kind of story when you take a history? Anyone want to tackle that one?
I'll help Kerry here. Look, the short answer is no. We just haven't had experience, and I hope we never do. In terms of cigarette equivalents, if you're looking at the disposable devices, which until recently, and most of the young people have been using, the amount of nicotine in 15 puffs of those fruit-flavoured disposables accounts to one cigarette. Okay, so 300 puffs, which was the original 2020 version, small device, is a pack of cigarettes. So if someone's got the cartoon character one with 3,500 puffs and they're going through one of those devices every 3 days, they're smoking 4 packs of cigarettes a day. And that's the sort of highlighting the amount of, that's the challenge that Bronwyn and the paediatric, medical nursing teams, psychologists have challenging this. This is an extraordinary amount of nicotine exposure for some, not all, but for some young people. Their exposure is extremely high. But in terms of disease and the eventual development of disease and risk related to pack years, no, we don't have that correlation.
Look, I think that's one thing that young people like to hear. They do like to hear if you can give them, what it's similar to, because perhaps, cigarette smoking is not as acceptable as vaping. So if they do understand that correlation is something that can be quite impacting for them, and a motivator for some change. Look, the other thing I do in just my general practice is asking, what type of disposable vape the young person is using. And at the moment, it's 3,000, 5,000, even up to 8,000 puffs, but knowing how long it takes a young person to get through that. So it might take them 1 week or 3 weeks. And then really looking at the pattern of their use and getting a bit of a history. Has that increased or has that decreased? And, then, their pattern of how long it takes them to get through those disposable vapes.
Kerry, can I ask you about, and a little bit premature, perhaps, because I know there's still work to be done, but the idea around the reforms is that it will make it easier for somebody who genuinely wants to use vaping as a smoking cessation tool to access that. It's not designed to limit that. It's designed to make it in a safe, accessible way. Is that correct? It's a question coming through.
Look, there's a range of initiatives to really support the prescription pathway. So we haven't actually had a registered product that could be prescribed in the usual way. The TGA's work is to try and make those products more consistent in the dose, limit the dose of nicotine, make them more like what we would see a pharmaceutical product looking like for that, so that we can have a little bit more confidence in it. The RACGP has also been doing a lot of work with updating its guidance to provide guidance to general practitioners, and we've been working with GPs to put on webinars and information sessions, and we'll continue to do that to support GPs, because we actually think GPs are going to be the front face of this, where both parents, young people will come for that source of truth. So probably, Tracy, that is clearly the issue. We really do support a prescription pathway, but that's holistically about, I think we can do nicotine, tobacco control a little bit better. So we want to, we're approaching this from a bit of agnostic between vaping or cigarette smoking. We want both to be as low as possible, and we're packaging it to general practitioners. As you said, people might be coming in with dual use. They might be coming with tobacco, where we can still, whilst we've made big inroads, there's still a long way to go. And some of the smoking disparities, and when we look at disparities across Aboriginal and non-Aboriginal people, really cause us to pause and reflect and redouble our efforts if we're going to close the gap in life expectancy, supporting them. But we also need to acknowledge, and I think Bronwyn's sort of given those examples, that often tobacco smoking or vaping will occur in a broader context for that individual. There'll be a lot of other social, environmental factors that interplay, and we need to understand that. And our models of care need to really acknowledge that often we might have to work on something else, homelessness or other aspects, before we can start talking about tobacco cessation with a client. So our services need to be much more holistic, much more sophisticated, and now much more tailored to the different segments of those that are smoking or vaping. So it's a challenge out there to all the clinicians online, that we haven't got a pigeonholed solution, but we need to do better.
Yeah, I appreciate those comments, Kerry. And Bronwyn, if I could come to you, and appreciating it, cessation doesn't happen in isolation. It is more holistic, as Kerry said. But can I get your thoughts on the best approach to cessation? I mean, we certainly know from years of helping with smoking cessation that empathy, understanding, supporting people's attempts are really critical in smoking cessation. Anything punitive or doesn't work, and shaming doesn't work. Is the same thing necessary for vaping, do you think, and particularly
Absolutely.
for young people?
Yeah, no, absolutely. I think doing any intervention with young people, anyone in particular, really having that empathy, having a trauma-informed approach, working with the goals of the young person or the patient who is in front of you, and doing that in a non-judgmental way, is really important. But look, I think, what strategies are really helpful for young people is, first starting with some behavioural strategies, identifying their stage of change and where their motivation is, but also what support network is around them. Often parents or carers might not really understand or know the significance of the nicotine component in the vape, or, that addiction component, or how difficult it is for a young person. So maybe bringing them alongside, to be aware and help is a good thing. For young people, identifying what their triggers might be is helpful, and identifying some, some goal setting, or a quit date, even similar to what you would do with smoking cessation, identifying the reasons to quit, and in that balance of, the pros and cons of the what the vaping is doing for them. And then really some practical tips, having some strategies to manage those withdrawal symptoms if they're really significant, and noting that they will dissipate. We know that they're going to, go after 3 to 5 days potentially, and, those cravings will last a little longer. So giving young people some really good tips as to how to, approach those, that withdrawal period. Even things like getting rid of the old vapes. Lots of young people like to collect them, and, all the different colours and flavours, and then use those old vapes to, get that last little puff out of it. So, even some things like getting rid of those, quitting with a friend, I think that's another really great thing. And hearing other people's stories. I love what Kate spoke about, and the testimonies of other young people who have quit, and hearing their stories is really, really great. Yeah, I think seeing your GP. Look, if those behavioural strategies don't, it's too hard for a young person by themselves, seek help. It's really important for young people to feel like it's okay to reach out and to seek some help. And maybe that GP might be able to then do that assessment of other things going on as well, the anxiety, or, if there's mental health, challenges, or, other substance use, or what else is going on for that young person, and, really be able to provide that holistic care.
Great. Kate, did you want to add anything to that? I know there's resources within the Institute, Quit Line, I Can Quit, and other things that you're working on that are available as well.
Yeah, thank you, Tracy. Actually, so much of what Bronwyn was talking about reflects one of the I think it's called native content pieces that it's coming out through the campaign, and it will be in pedestrian. I hope I'm not giving too much away. Look out for it. It is wonderful. But we've followed a young person who has quit over a 2-week period. So started out on day one saying, oh gosh, I'm about to quit, talked about some of the social cues that he's talked to his friends or their friends about what's going on for them. And you're able to see him report some of the withdrawals that he experiences throughout the process. He calls Quit Line. Didn't think to call Quit Line, but a bit of prompting from us, he called the Quit Line and actually found that there was real benefit in the advice that he was able to get through calling Quit Line. All of this is filmed and will be coming out through some of the social channels. It is wonderful to just see someone go through the process in their real life and be able to share that where young people are. It's wonderful. So yeah, we do have the Quit Line. We do have I Can Quit information on there. We do have information on our Cancer Institute website. There's plenty of information on the ministry's website as well. And we're working closely with young people to develop more digital support, particularly in the form of an app. We will be co-designing as much as we can in that space. And we're really loving working with those young people so closely and just having them lead the way. Thanks, Tracy.
Okay. Now, one of the questions that came through before the seminar, in number of people had asked, and we've touched on it briefly, is the so-called gateway effect. And there is data that suggests that vaping is a gateway to using combustible cigarette smoking. And I think it was the Generation Vape study that showed young people who have never smoked cigarettes who start vaping were 3 times as likely to then go on to smoke. Can I get some comments a bit on that gateway effect? I think Matthew, Bronwyn and Kerry have all alluded to it. It'd just be great to hear some further thoughts about that.
Okay, Tracy, if I can kick off, it's a very robust number. In a range of studies, meta-analyses and everything, it's about 3-fold increase of progressing to combustible tobacco use. It's robust in every respect. The more you look at the characteristics of a young person who is less likely to smoke, the stronger the association becomes. So if your propensity to smoke based on, social circumstances and psychological wellness is low, vaping has a greater chance of propelling you into smoking. So it's sort of the common liability hypothesis, which is the, kids who are going to smoke, kids who are gonna, all that sort of thing. The data actually repudiate that, and not surprisingly, I mean, it's a huge amount for a young person to pick up disposable vape. The concentration that Professor Kelso and her team from Wollongong has demonstrated in the New South Wales vape samples. You're talking about 2.5 times as much nicotine as is legally able to be sold in a vape in the UK or Europe. So, all the efforts that Dr. Chand and the others have put to change the regulations and eventually the legislation, we hope, to get those off the scene will be very good. Yeah.
Okay. Anybody else want to add anything to Matthew's comments there around gateway effect?
I think go, Bron.
I was just going to say, from a clinical perspective, I think it's important for us to ask the questions. If we know a young person is vaping, we need to check in with them around not just the pattern of their vaping, whether it's increasing or decreasing, or what units they're using, what disposable vapes, or are they using other things as well? But then also to ask about, what about normal cigarettes? Have you tried, and how often, and when do you use it? And often they might, depends on availability, go between the two of them. So I think it's asking those questions, and then really having an open discussion with young people about their goals and the harms associated, and being there for them when they're ready to quit or seeking support. Yeah.
Mm-hmm.
I was just going to add that it's a few people from our formative research in terms of services. Some young people have talked about moving to smoking as a way to moderate or restrict the nicotine intake around quitting vaping. So it's interesting to see how traditional tobacco is being used in that instance as well.
My teenagers tell me it's all about pouches now. It's about the lip pillow, the upper decky. We've moved on from vaping. Get with it, mum. Obviously, this is another thing that the big tobacco are pushing out. Sold in supermarkets in the UK, completely unregulated. Gas stations in Canada, variable regulation in the EU, banned in Germany, but available freely in other countries. Certainly starting to be seen a lot more in Australia. Kerry, in terms of the reforms, will they be caught up in the reforms as well, or is it just concentrating on e-cigarettes? Do you know the answer to that? You're on mute, Kerry. 10 push-ups for you.
Apologies. Look, the reforms are focused on e-cigarettes, but I think that we are conscious of the evolution of nicotine pouches, and when our inspectors have been going out and raiding it, what we find is e-vapes, e-cigarettes, we find occasionally the nicotine pouches, not in the predominance as the e-cigarettes, but also we're seeing loose leaf tobacco, flavoured tobacco, mislabeled illegal tobacco. So all of these things reflect that there's probably some conjoint of all of these marketable products, and they probably have one thing in common in that they deliver nicotine and lead to addiction. So when we're continuing to regulate or act in this way, I think it's really important that our objectives are to reduce both e-cigarettes, the use of nicotine-containing products, including nicotine pouches, e-cigarettes, or tobacco. We still have to see it as sort of an amalgam.
Okay.
Maybe I'll make a comment, Tracy. Yeah, I was going to mention the pouches because, we are seeing that more frequently. And I think it's an indication that young people are aware of their nicotine in the vaping and that nicotine dependence and the symptoms, and whether or not some young people might use those pouches to try and assist with those nicotine withdrawal symptoms. So I think using it as a trigger to say, hey, why don't you get to your GP to seek some medical help, because they can actually help you with prescribed nicotine replacement therapy products that we know the dosing, we know that combined patches and long-acting and short-acting NRT is helpful in smoking, cessation. So it's using those principles to help with management of nicotine dependence and withdrawal symptoms. So asking the questions and being, aware of what young people are using. Yeah, thanks, Kerry.
And sorry to cut over you, Bronwyn, but just Tracy, just to be clear, they are illegal. So they're not meant to be sold. Yes. And as I said, our inspection activities indicate that we're often finding mixed products when we go and do those seizures, reflecting the diversity in the market.
Yeah, okay, terrific. We've got through most of the questions. There's one here, any evidence on neurodevelopmental effects of vaping, or is it too early to say? Anybody want to tackle that one?
Probably too early to say. Nicotine has a deleterious effect, in psychological development, in psychological wellness. There's a complex relationship between depression and nicotine use, probably bidirectional. If you're depressed or anxious, you're more likely to use nicotine. If you initiate nicotine, you're more likely to develop depression or anxiety. That's sort of neurodevelopmental, and it compromises sleep. And of course, sleep is critical for optimal development and educational performance in young people. So I hope we never get enough information to answer that question if we're able to address it through all the measures that the panel have described with good effect.
Bronwyn, did you have anything to add to that?
Yeah, maybe perhaps the advice for pregnant women, is to cease vaping if they are vaping, because of the impact of nicotine on the developing, fetus, developing baby. We know that the impact of nicotine on the baby can be also increasing the risk of ADHD and other neurodiversity.
Yeah.
Learning difficulties.
Yes. Okay.
Smaller size babies.
Yeah. Okay. There's one more question there around what are the chemicals in vaping that are linked to carcinogenic effects? Matthew, do you want to take that for me as I'm happy to. But...
Okay. So, we know that, again, from the University of Wollongong analysis, there are specifically banned cancer-causing chemicals that are in it. Vaping is the process inhales a really complex cocktail. Starts with the liquid that's put in. It's a composite itself, and there are chemical reactions in the liquid, all right, over time, and then they're superheated, and the new chemicals are formed during that superheating process. If you've got an ordinary disposable vape, that's just soaked in some crummy sponge. So you superheat the sponge, you get bits of sponge, and then the metal coil. And I know that some of you have seen the degraded coils again from the Wollongong publication. That metal, which is in the degraded coils, only got one way. It's gone into the patient, onto the user. All right, so you've got metals, you've got aldehydes, really toxic carcinogenic stuff, but actually what's specific, and indeed we don't know yet what specific vaping constituents cause the adverse effects, pre-neoplastic changes in the mouth of young people. And again, I keep saying this, I hope we never have to find out. It'd be really good if we could jump on this.
Yeah. Kerry, as the Chief Health Officer, final last word, anything you'd like to add in the remaining minute or so?
Look, I suppose whilst we're tackling e-cigarettes and just to reflect on the young people's experience of this, and also I think just to reflect on schools and how the school environments are really challenged by e-cigarettes and the behaviours consequent on that. And sorry, apologies, it's one of those moments on the screen. So I think that for me, the fact that parents are really reflecting that they're finding it difficult to know how to have the conversations with their young people, and the need to support parents in addressing this. But this is probably one of the touchstones that when we've reached out, the level of concern amongst parents and young people around the impact has been quite informative. And for me, that's really resonated with me around the harms.
Okay, terrific. Okay, well, look, we're at time, so thank you to everybody that joined tonight. You've held the attention of a few hundred people in the evening, so I really thank the panel for their time. This conversation will be uploaded onto the Cancer Institute of New South Wales website, and the link will be emailed to all the registered recipients so it can be shared with colleagues. There were a number of audience questions, and we got through most of them. I apologise if I didn't get to your answer. A key facts and frequently asked questions and info sheets will be updated and disseminated to all of the registrants tonight. There's lots of information available online at the Cancer Institute website and on the Ministry of Health website. So I encourage people to jump online if they'd like to see more information. Again, thanks very much to Dr. Kerry Chan, Professor Matthew Pingers, Dr. Bronwyn Milne and Kate Reeks as well for joining tonight. Thank you very much for me. I look forward to seeing everyone at the next instalment of the Cancer Conversations in August. Enjoy the rest of your evening, and thank you.